Everything you need to know about alopecia areata. What is alopecia areata? Alopecia areata is a condition that causes hair to fall out in small patches, which can be unnoticeable. These patches may connect, however, and then become noticeable. The condition develops when the immune system attacks the hair follicles, resulting in hair loss. Sudden hair loss may occur on the scalp, and in some cases the eyebrows, eyelashes, and face, as well as other parts of the body. It can also develop slowly and recur after years between instances. The condition can result in total hair loss, called alopecia universalis, and it can prevent hair from growing back. When hair does grow back, it's possible for the hair to fall out again. The extent of hair loss and regrowth varies from person to person. There's currently no cure for alopecia areata. However, there are treatments that may help hair grow back more quickly and that can prevent future hair loss, as well as unique ways to cover up the hair loss. Resources are also available to help people cope with stress related to hair loss. Causes of alopecia areata. Alopecia areata is an autoimmune condition. An autoimmune condition develops when the immune system mistakes healthy cells for foreign substances. Normally, the immune system defends your body against foreign invaders, such as viruses and bacteria. Chemicals, regular and long-term use of cosmetics, such as shampoos, conditions, serums that are sulfur, ether, and paraben-based, damage the hair follicles, thereby provoking hair fall and, later, alopecia if not controlled within time. Mechanical. Tying the hair tightly for a long time causes the hairline to recede back, leading to traction alopecia. Hormonal factors. Alopecia is linked with certain hormonal fluctuations. It has been observed that a few cases of alopecia occur during various stages of life where the hormones have an active role to play. Alopecia areata is found being triggered during puberty, menopause, and after delivery. Trichotillomania. It is a psychological disorder where a person is compelled to pull out his/her own hair on the scalp, eyebrows, eyelashes, and on other hairy areas of the body. Fungal infection. Conditions affecting the scalp, such as seborrheic dermatitis and tinea capitis, can also lead to patchy hair loss in the diseased area. This is a reversible condition since hair grows back once the underlying fungal infection affecting the hair follicles is treated. Genetic factors. Many genes have been linked with alopecia areata that participate in the body's immune response. The genes belonging to HLA, human leukocyte antigen, are responsible for modifying the immune response and targeting the hair follicles. It is often seen that individuals suffering from this disorder have some other autoimmune disorder unlike alopecia areata running in their families. Associated disease condition. Individuals suffering from other autoimmune skin diseases, such as psoriasis, atopic dermatitis, eczema, and lichen planus, are prone to develop alopecia areata. For instance, a person having psoriasis of the scalp has scaling, itchy skin which leads to a hair loss, thereby causing bald patches in the affected area. A similar presentation is seen in the other two skin disorders. When baldness occurs as a result of these underlying conditions, this type of alopecia areata is called as scarred alopecia. In this particular condition, the hair does not grow back due to a permanent scar formation over the hair follicles. This scar destroys the hair follicles, thereby causing permanent balding in that area. Symptoms of alopecia areata. The main symptom of alopecia areata is hair loss. Hair usually falls out in small patches on the scalp. These patches are often several centimeters or less. Hair loss might also occur on other parts of the face, like the eyebrows, eyelashes, and beard, as well as other parts of the body. Some people lose hair in a few places. Others lose it in a lot of spots. You may first notice clumps of hair on your pillow or in the shower. If the spots are on the back of your head, someone may bring it to your attention. However, other health conditions can also cause hair to fall out in a similar pattern. Hair loss alone isn't used to diagnose alopecia areata. In rare cases, some people may experience more extensive hair loss. This is usually an indication of another type of alopecia, such as alopecia totalis, which is the loss of all hair on the scalp. Alopecia universalis, which is the loss of all hair on the entire body. Doctors might avoid using the terms totalis and universalis because some people may experience something between the two. It's possible to lose all hair on the arms, legs and scalp, but not on the chest, for example. The hair loss associated with alopecia areata is unpredictable and, as far as doctors and researchers can tell, appears to be spontaneous trusted source. The hair may grow back at any time and then may fall out again. The extent of hair loss and regrowth varies greatly from person to person. Alopecia areata in males. Alopecia areata occurs in both men and women, but the loss of hair is likely to be more significant in men. Men are also more likely to have a family history of the hair loss condition. Men may experience hair loss in their facial hair, as well as their scalp, chest, and back hair. Compared to male pattern baldness, which is a gradual thinning of hair all over, hair loss from this condition causes patchy hair loss. Alopecia areata in females. Females are more likely to develop alopecia areata than males. The hair loss can occur on the scalp, as well as the eyebrows and lashes. Unlike female pattern hair loss, which is a gradual thinning of hair that covers a large area, alopecia areata may be confined to a small area. The hair loss may occur all at once, too. The area can gradually expand, which results in greater hair loss. Alopecia areata in children. Children can develop alopecia areata. While there is some hereditary component to alopecia areata, parents with the condition don't always pass it on to a child. Likewise, children with this type of hair loss may not have a parent who has it. In addition to the hair loss, children may experience nail defects, such as pitting or lesions. In addition to the hair loss, children may experience nail defects, such as pitting or lesions. Types. Several types of alopecia areata exist. Each type is characterized by the extent of hair loss and other symptoms you may be experiencing. Each type may also have a slightly different treatment and prognosis. Alopecia areata, patchy. The main characteristic of this type of alopecia areata is one or more coin-sized patches of hair loss on the skin or body. If this condition expands, it may become alopecia totalis or alopecia universalis. Alopecia totalis. Alopecia totalis occurs when you have hair loss across the entire scalp. In this variety, there is a loss of hair over the whole scalp, alopecia universalis. In addition to losing hair on the scalp, people with this type of alopecia areata also lose all hair on the face, eyebrows and eyelashes. In alopecia universalis, a complete hair loss occurs all over the body, including the beard, armpits, and the private parts. Diffuse alopecia areata. Diffuse alopecia areata may look a lot like female or male pattern hair loss. It results in sudden and unexpected thinning of hair all over the scalp, not in just one area or patch. Traction alopecia. Baldness is caused due to the constant mechanical pulling of the hair. This is a reversible condition if treated early, but it may become irreversible in the later stages. Ophiasis alopecia. Hair loss that follows a band along the sides and lower back of the scalp is called ophiasis alopecia. How is alopecia areata diagnosed? A doctor may be able to diagnose alopecia areata simply by looking at the extent of your hair loss and by examining a few hair samples under a microscope. Your doctor may also perform a scalp biopsy to rule out other conditions that cause hair loss, including fungal infections like Tinea capitis. During a scalp biopsy, your doctor will remove a small piece of skin on your scalp for analysis. Blood tests might be done if other autoimmune conditions are suspected. The specific blood test performed depends on the particular disorder the doctor suspects. However, a doctor will likely test for the presence of one or more abnormal antibodies. If these antibodies are found in your blood, it usually means that you have an autoimmune disorder. Diagnosis. may be able to diagnose alopecia areata simply by looking at the extent of your hair loss and by examining a few hair samples under a microscope. May also perform a scalp biopsy to rule out other conditions that cause hair loss, including fungal infections like Tinea capitis. During a scalp biopsy, we'll remove a small piece of skin on your scalp for analysis. Blood tests might be done if other autoimmune conditions are suspected. The specific blood test performed depends on the particular disorder the doctor suspects. However, it will likely test for the presence of one or more abnormal antibodies. If these antibodies are found in your blood, it usually means that you have an autoimmune disorder. Other blood tests that can help rule out other conditions include the following: C-reactive protein and erythrocyte sedimentation rate, iron levels, anti-nuclear antibody test, thyroid hormones, free and total testosterone, follicle stimulating and luteinizing hormone. Diet. Foods with sugar, processed snacks, and alcohol may increase inflammation and irritation within the body. Some individuals with a diagnosed autoimmune condition may consider following an anti-inflammatory diet. This type of eating plan is designed to help reduce the autoimmune response in the body and decrease the chances of another hair loss episode or further hair loss. To do that, you eat foods that are known to ease the inflammation process. The foundational foods of this diet, also known as the autoimmune protocol, are fruits and vegetables like blueberries, nuts, seeds, broccoli, beets, and lean meats like wild-caught salmon. Eating a balanced diet, one with whole grains, fruits, vegetables, and lean meat, is beneficial to your overall health for many reasons, not just for reducing inflammation. Homeopathic medicines for alopecia areata. Fluoric acid. Tendency to develop alopecia in families. Brittle hair. Idiopathic hair fall. Hair falls in spots, vertex baldness. Hair tangles easily. Light-hearted attitude towards life. Extreme irritability and anger. All complaints aggravated by warmth and better by cold application. Phosphoric acid. Any sort of grief leading to hair fall. Takes stress easily. Early graying of hair, sometimes in childhood. Progressive thinning of hair. Difficult comprehension of things. Long-standing effects of mental agony and patient lives in the state of shock for long. Extreme debility. Craves juicy things. Phosphorus. Patchy baldness. Dryness of hair and scalp, itchy scalp, dandruff. Hair fall in handfuls while combing. Frontal baldness. Thin physique, long fingers, high cheekbones. Weakness with excess emotional vulnerability and impressionability. Extremely sympathetic persons who go out of the way to help others. Hair fall after any hemorrhagic disorder. Scurvy. Fearful when alone. Better in company. Graphites. Hair fall on sides. Patchy baldness. Itchy, humid eruptions on scalp that emit fetid odor. Constipation associated with hair fall. Chilly, fat patient with tendency to develop one or the other skin problems. Menopausal hair fall. Mesoreum. Hair stick together. Fall in handfuls. Crusty eruptions on scalp leading to hair fall. Itchy scalp, dandruff. Alopecia areata affecting scalp leading to hair fall. Sensitive to cold air, skin rashes, eruptions, crusts below which is yellow purulent matter. Sepia. Baldness menopausal. Hair fall after delivery of the child with mental depression, leading to indifference later on. Hair pains when touched because of extremely sensitive hair roots. Irritability increased, with snappish attitude. Pimply eruptions near the hairline on forehead. Silica. Baldness in young people, hair fall in frontal and forehead region. Early graying of hair, chilly with excessively sweaty cold palms. Nervous and anxious disposition. Mild types. Fixed ideas, highly impressionable. Natrum muriaticum. It is frequently prescribed in cases of hair loss, especially in anemic females. Lycopodium. This drug is frequently prescribed for complaints of hair loss, premature baldness, premature graying of hair. Offensive secretions and violent itching are a few of its common indications. The complaints are worse from warmth and better by cold applications. Nitricum acidum. It's one of the commonly used drugs for hair loss. Loss of hair from the vertex. Sensitiveness of the scalp. Treatment. There's no known cure for alopecia areata, but there are treatments that you can try that might be able to slow down future hair loss or help hair grow back more quickly. The condition is difficult to predict, which means it may require a large amount of trial and error until you find something that works for you. For some people, hair loss may still get worse, even with treatment. Medical treatments. Topical agents. You can rub medications into your scalp to help stimulate hair growth. A number of medications are available, both over-the-counter, OTC, and by prescription. Minoxidil, Rogaine, is available OTC and applied twice daily to the scalp, eyebrows, and beard. It's relatively safe, but it can take a year to see results. There is only evidence that it's useful for people with limited alopecia areata. Anthralin, Drithoscalp, is a drug that irritates the skin in order to spur hair regrowth. Corticosteroid creams such as clobetasol, Impoise, foams, lotions, and ointments are thought to work by decreasing inflammation in the hair follicle. Topical immunotherapy is a technique in which a chemical like diphencyprone is applied to the skin to spark an allergic rash. The rash, which resembles poison oak, may induce new hair growth within 6 months, but you'll have to continue the treatment to maintain the regrowth. Injections. Steroid injections are a common option for mild, patchy alopecia to help hair grow back on bald spots. Tiny needles inject the steroid into the bare skin of the affected areas. The treatment has to be repeated every 1 to 2 months to regrow hair. It doesn't prevent new hair loss from occurring. Oral treatments. Cortisone tablets are sometimes used for extensive alopecia, but due to the possibility of side effects, you should discuss this option with a doctor. Oral immunosuppressants, like methotrexate and cyclosporin, are another option you can try. They work by blocking the immune system's response, but they can't be used for a long period of time due to the risk of side effects, such as high blood pressure, liver and kidney damage, and an increased risk of serious infections and a type of cancer called lymphoma. Light therapy. Light therapy is also called photochemotherapy or phototherapy. It's a type of radiation treatment that uses a combination of an oral medication called Ceralens and UV light. Natural treatment. Some people with alopecia areata choose alternative therapies to treat the condition. These may include aromatherapy, acupuncture, microneedling, probiotics, low-level laser therapy, LLLT, vitamins like zinc and biotin, aloe vera drinks and topical gels, onion juice trusted source rubbed onto the scalp, essential oils like tea tree, rosemary, lavender, and peppermint, other oils like coconut, castor, olive, and jojoba. An anti-inflammatory diet, also known as the autoimmune protocol, which is a restrictive diet that mainly includes meats and vegetables. Scalp massage. Herbal supplements, such as ginseng, green tea, Chinese hibiscus, and saw palmetto. Most alternative therapies haven't been tested in clinical trials, so their effectiveness in treating hair loss isn't known. Additionally, the Food and Drug Administration, FDA, doesn't require supplement makers to prove their products are safe. Sometimes the claims on the supplement labels are inaccurate or misleading. Always talk to a doctor before trying any herbal or vitamin supplement. The effectiveness of each treatment will vary from person to person. Some people won't need treatment because their hair grows back on its own. In other cases, however, people won't see improvement despite trying every treatment option. You might need to try more than one treatment to see a difference. Keep in mind that hair regrowth may only be temporary. it's possible for the hair to grow back and then fall out again. Alopecia areata prognosis. The prognosis for alopecia areata is different for each person. It's also unpredictable. Once you develop this autoimmune condition, you may live with bouts of hair loss and other related symptoms for the rest of your life. Some people, however, may experience hair loss just once. The same variation applies to recovery. Some people will experience full regrowth of hair. Others may not. They may even experience additional hair loss. In people with alopecia areata, poor outcomes are associated with several factors: early age of onset, extensive hair loss, nail changes, family history, having multiple autoimmune conditions. How to cope with alopecia areata. Alopecia areata can be emotionally challenging, especially when hair loss affects the whole scalp. People with the condition may feel isolated or become depressed. It's important to keep in mind that more than 5 million people, trusted source in the United States, have alopecia areata. You aren't alone. There are lifestyle changes you can make to help cope with the condition. If you're looking for help with wigs, eyelash extensions, or eyebrow stencils, the National Alopecia Areata Foundation maintains an online shop with hair accessories and products. Wig companies like Godiva Secret Wigs also have online videos and tutorials for help with styling and care. Active teens and young adults with completely bald heads can attach suction cups to wigs and hair pieces so the wig won't fall off while playing sports. New wig technologies, like the vacuum wig, which is made from silicone and a suction base, mean that people with alopecia can even swim with their wigs still in place. Vacuum wigs, however, are typically more expensive. If hair loss affects the eyebrows, an eyebrow pencil, microblading, and eyebrow tattoos are a few options to consider. Microblading